This is Dr. Karamanukian of the Buffalo Niagara Vein Treatment Centers and www.veinsveinsveins.com talking about 10 ways to reduce risk of developing deep vein thrombosis or DVT. Number 1. If you are scheduled to have a surgical procedure, notify your physician if you have suffered from a deep vein thrombosis in the past. This will alert the physician to be more judicious in administering prophylactic measures such as injecting subcutaneous heparin and using calf muscle pumps and foot pumps in the peri-procedural period. 2. While driving long distances, break up the trip with frequent rest stops every 2 hours to walk. This means walking for 1 or 2 minutes, walking around the car, or exercising your lower legs. 3. If you are in a plane, calf stretching exercises at regular intervals will reduce the likelihood of developing deep vein thrombosis. Getting out of your seat and walking whenever you can also help reduce the risk of deep vein thrombosis. 4. Avoid sitting for a long period of time. Getting up and moving around once an hour, even if it is for 1 or 2 minutes, will reduce the likelihood of developing deep vein thrombosis. 5. When sitting, heel-toe exercises will also reduce the likelihood of developing deep vein thrombosis, especially in jobs that require answering telephone calls or using computers. 6. Avoid drinking fluids such as alcohol, coffee, and tea, which can cause dehydration and increase the risk of developing deep vein thrombosis. This risk factor, however, is controversial in the literature. 7. If you have an increased risk of clotting, also called thrombophilia, do not use birth control pills. 8. Get diagnostic blood work done, such as genetic testing, to determine if you have an inherited risk of developing deep vein thrombosis. This is especially true if there is a history of deep vein thrombosis in your family. A formal discussion with your primary care physician, a vein specialist, or a hematologist may be very helpful. 9. If you have had an episode of deep vein thrombosis in the past, if you are pregnant or have varicose veins, it may be helpful to wear Class 1 compression stockings on a daily basis. This should also be discussed with your vein specialist, also known as a phlebologist or hematologist. 10. Cessation of smoking may also reduce the likelihood of developing deep vein thrombosis, even though this is controversial in principle. For more information, contact Dr. Harach Karamanukian at the Vein Treatment Centers of Buffalo Niagara, or go to www.veinsveinsveins.com, or call us at area code 716-839-3638. We can also be contacted through www.peacebridgehealthcare.com. Peacebridge Healthcare is located minutes away from major Canadian cities. Canadian patients are welcome at our facilities. Thank you. This is Dr. Karamanukian, a board-certified phlebologist, also known as a vein specialist and cardiovascular surgeon.